question. I guess first up, regarding the second wave that we're now in, today across the country we saw case counts top 200,000, and my calculation is that BC is still less than 6% of the total across the country. So what more can we be doing to try to keep this virus from spiraling out of control in this province when we're seeing now a record number of daily cases in this province just yesterday?
Yeah, I think what we're seeing and the fact that we are underrepresented in what's been happening nationally is a testament to the fact that people in BC are doing the right thing. The vast majority of people have taken this to heart. We're making sure that our communities can still function, that kids can still go safely to school. And what we're seeing are exposures that are related to this ongoing transmission. So keeping up our vigilance is really important, making sure we get tested when we need to, taking all of those measures that we have been doing, and not losing heart. As you can see, we are still able to manage it here. We're doing well. Our public health teams are supporting everybody who's been exposed, everybody who's been tested positive, to make sure that we can keep a lid on it and not let things grow. But we all have to continue to do our part. Businesses need to follow their COVID safety plans, whether it's a small business or a retail outlet or a restaurant. When we follow those plans, we know that we can make a difference and we can stop the spread. We need all of us to consider our community, and we talked about this before Thanksgiving, being grateful, but being grateful in a way that protects those who are most at risk, particularly our seniors and elders. And we need to continue doing that, and we've shown that we can do that, and we're going to weather this storm together.
Do you have a follow-up, Marcella?
I do. It's regarding all the speculation that we're hearing on social media. I'm getting emails from people, but just asking you to respond to all the speculation out there from frustrated parents and others who seem to be suggesting that there's a deliberate lack of clarity when it comes to keeping this virus out of BC schools, and whether or not we're asking teachers and other school employees who might be sick to still go to work because you're worried about possible staffing shortages.
Yeah, well, I can say that that's not the plan. No, there's no conspiracy. And I think we all need to be patient and to recognize that there are ways that we do things to make sure that people aren't inadvertently exposed as somebody who might be carrying COVID-19 or might be infected. And there's a very good reason for that. And it's about finding a balance. And every single exposure event is being posted. And those people who have had contact are being contacted by public health, and I am confident, and I have heard repeatedly from families who've been involved, that they are getting the support they need from public health, and I think we need to continue doing that, continuing to be patient with each other and to not feed on rumors that we may or may not know to be true. And sometimes it's very challenging because we are all worried. I know parents are worried, and sometimes that anxiety spreads to our children too, and our kids are a little concerned. We're worried about what may happen, and we know now, we've been through this for now almost 2 months, and we know that sometimes there are exposures in schools, but we have not seen widespread outbreaks. We've seen very limited transmission, and that tells us that things are working in our schools. Things are being followed, things are being managed, we have good connections with public health, and that we're making it through this, and we need to keep doing that and keep making it through this for the sake of our communities and our children in the next coming months. And it may be challenging some days, particularly as we see more influenza season, more influenza illness come by. And we know that we don't want people in schools with influenza either. So yes, we need to keep monitoring this, and we will be there in public health to support schools.
Just as it relates to enforcement, be it in public or now that schools are back, every time parents pop by the schools, they note that every parent and every adult seems to be social distancing, but there seems to be very little going on with the children in the schools. Not that we're enforcing this on the schools or on children, but how does that work as far as again educating through the government down to the teachers, through the education, and then to parents and children as well? Are there steps that can be taken? Because every time the bell rings for pickup, it's the same song and dance at certainly every school here in the north.
Well, I've actually seen many great examples of how it's being managed in schools around the province. Haven't been up to the north recently. I was trying not to fly too much. But I do know that not only are kids resilient and adaptable and learning, but they bring that home to their parents in many cases too. And I just want to salute the teachers and the staff, the educators around the province, because they are working it out in schools. And we're seeing that. We're seeing small exposure events occasionally when people, usually as part of a family cluster, or somebody's exposed at work, somebody comes into a school, but we're not seeing a lot of transmission. So children are paying attention, and I think it's a testament to the work that the schools are doing and that the teachers are doing across the province, that it is keeping our classes open, keeping children learning in an important environment.
Rob, do you have a follow-up?
Certainly. Just as it relates to a specific family up here, obviously not getting into the identity of the family or anything like that, but we had a family that was awaiting an elementary student pending a test. Meanwhile, their older sibling was told they didn't have to isolate, and then, obviously, to me, that would render the test, but also the results of where contact tracing it could be traced to almost irrelevant if you've got, one sibling in the house having to isolate because they're waiting for a test result. Meanwhile, older sibling can come and go as it pleases, or as they please. Is that something that is flat out just a mistake, or is that something that, again, they're following the protocol, and if that's the protocol, that's good enough for the family if it's good enough for the province?
Yeah, so everything, it depends. Nothing is black and white when we're talking about this. So it would depend on the circumstances around one of the children. If they would just had mild symptoms that weren't associated with an exposure to COVID, then it may not be required. In most cases, it would not be required for the rest of the family to self-isolate. They would want to ensure that the child who is ill stays away as much as possible from the others, but as long as everybody else is feeling well and have not had an exposure to somebody with COVID-19 themselves, then they would not necessarily need to isolate.